I did go to the National Association of Dental Plans meeting. It's actually probably the most valuable meeting for me of the year. I feel like Nostradamus because my predictions on Medicare Advantage are coming true. So let me give you some of the trends and the information that I think you're going to need to have to really make good decisions in your practice. There's policies and procedures, there's good ways to do business, and then there's quick ways to do business. Not unlike somebody who wants to skip dental school and just start taking out teeth. I mean, I wish we could do that. I wish you could fast track and be very successful in a third-party billing company business, but welcome back to another episode of Nobody Told Me That. I am flying solo again. I have a trip report for you this time. I have been crazy with travel, but I did go to the National Association of Dental Plans meeting, and that was in Palm Springs, California, which is, way across the country for me, but that's okay. This is one of those meetings that, although it's an insurance meeting and you're probably thinking, goodness, why would she go to this meeting? It's actually probably the most valuable meeting for me of the year. And I'll explain why in just a second. But it was busy, lots of stuff going on there. And there were a lot of updates that came out of it and a lot of side conversations that I had, which I think are just too much to put into a newsletter. So I figured, let me just go ahead and do a podcast for you. And then you can skip ahead if I'm talking about something that you're really not interested in. So National Association of Dental Plans, typically it is, I would say 99% attended by the dental carriers, of course. All of the big dental carriers are there. And in recent years, I've been a member for 8 years. And in recent years, I've seen a lot of DSOs join and attend. And so the mix of the meeting is really changing. I mean, definitely still the majority are carriers, but you're also seeing a ton of DSOs, managers, revenue cycle managers, and then people like me who are trying to understand the industry and really be that, of course, as you know, the bridge between payer and provider. It's just a really good place to go and meet and realize that we're not so different. So the carriers, when they realize you don't have horns, when you meet carrier people and you realize they don't have horns, you actually get a lot of stuff done, which is why we're seeing so much of the DSO community go to this meeting. In fact, the lobby of the hotels, last couple times we've had this meeting, have been full of people having meetings. So a lot of times DSOs will send their credentialing teams and they will just knock out, meeting after meeting after meeting with different carrier representatives. So it's very, very productive if that's your goal. Many of these meetings are set up ahead of time. I had tons of classes I wanted to take, but also I had a full roster of meetings myself, just information gathering, my own business needs, having conversations there and seeing what I could do differently with Odyssey and with Dental Revenue Network. So really, really productive meeting. So let me give you some of the feedback that I got, but also a lot of the trends and the information that I think you're going to need to have to really make good decisions in your practice about, of course, participation, administrative burden, and just in general, how to factor insurance into your own profitability. It is possible. Many of you have heard me say that it is possible to be in network and be profitable. It's just you have to be super, super efficient and super business savvy. And that's just not typically the case, only because, again, dentists did not go to school to become business people. On the flip side, hopefully this conversation too, it may help to guide you in that decision if you're on the fence. You may hear me say something about Medicare Advantage coming up that just says, you know what, I'm out, or might say, listen, I'm in a pretty big senior area. Maybe I do need to get on this Medicare Advantage train. So it's going to be all things to all people. As always, send me questions if you've got them, but let's go ahead and dive in. I've got a couple different topics here. I even have an outline for my podcast. A lot of times it's just fun, right? But this one I was like, oh, I better write all this down so I don't forget anything. First, I want to thank a lot of the Dental Revenue Network members that were there. We got together, we interacted, had some pictures. That was a lot of fun. You had Clint Johnson, Profitable PPOs, Patrick O'Rourke, and Practice Quotient. You had Sandy Hudson, Lisa Weber with Unlock the PPO, and a few other people. Colleen Huff was there, Michelle Rapash, Lisa Greer from CDA was there. Lots and lots of representation there. Leslie Eisnogel was also there with Dental Classroom Online. So it was really good to get together with all of those people and just really be in dental insurance geek heaven, right? I mean, if you're listening to this podcast, then you know you've had conversations with other dental people and you're like, oh, they get me. And then you realize, but they're not as nerdy as I am. And that's okay. So it's good to be around other nerdy people. It was great to hang out with them. And we kind of did that thing that when you go as a team, you divide and conquer, right? And then you kind of get back together and you say, hey, what did you like from this? And hey, what did you like for that? And so one of the classes that we attended had to do with contracts, legislative updates, and so forth. Now, the general session was legislative updates, really the landscape under the Trump administration. And it was like updates to Medicaid, updates to federal workers, some of the laws that are going to affect us. And overall, there was a general consensus that, you know, it's kind of unpredictable right now what's going on in there. And I think that's pretty standard. I don't think anybody's surprised by that. The big takeaway is Medicaid, of course. There will be some cuts. Looks like some states are already cutting in anticipation. And so if you're a Medicaid office, you do want to take a look at, you know, are reimbursements going to change? And is adult Medicaid being taken off the table? If it was on the table, is that something that you're going to have to pay attention to? Now, to be fair, anytime you are a Medicaid provider and adult Medicaid gets added into the mix because the state, you know, is now allowing the adults in, this is a very politically charged topic. And so there will be, depending on if there's a turnover in who controls the state, there will be a turnover for adult Medicaid, adults getting access to Medicaid and not. So right now, if you are in a state that allows adult Medicaid, especially with the way the new funding is going, you may not see adult Medicaid unless, again, there's a change in the state legislature. The side of that, though, I mean, so there's two sides to that, and I don't want to get too deep into Medicaid, but Medicaid, as you all know, is a funded plan, you know, by taxpayers and by the federal government. And so state taxpayers and then by all taxpayers via the federal government. And so when you add adult Medicaid, there's a lot more dollars that are being spent. And if you're in a state that is not really generating a lot of revenue, I mean, it's almost like being in a dental office. If it's not working, you know, if nobody's watching the Netflix subscription, you got to get rid of the Netflix subscription or something like that. I'm trying to make an analogy. That's probably not a really good one, but you have to have money coming in order to pay for dollars going out. And adult Medicaid is one of the, traditionally it's always been on the chopping block. So you might also see cuts in other areas not relating to dental, but let's just keep specific on dental. So again, Medicaid offices, pay attention to how this is affecting you and your business. And I think as a Medicaid office, you've always got to be thinking 2 or 3 steps ahead. The other issue legislatively that we need to watch out for, and this is across the board, there has been a renewed focus on fraud investigations, false claims acts, things like that. So this is a good time for you to make sure that you have all of your compliance training up to date yearly. If you are a Medicaid provider, your Medicaid website, believe me, has all of the documentation you need in order to be compliant should an audit happen. And I'm talking specifically about fraud, waste, and abuse. And I'm also talking about the list of people. I believe it's the LIEI list. I will make sure there's a link in the show notes, but it's basically a list of people who cannot participate or cannot be employed in an office that receives federal or state funding. And so you as a Medicaid provider, part of your agreements in almost all of the states, you agree to check this list on a monthly basis because they do add to it every month. So again, I'll make sure that there's a list in there. If you've never heard of this before, this is not the year to think, oh, I'll get around to it, because there has been increased attention, lots and lots of press releases about how they're going to really be cracking down on healthcare fraud. Now, in dentistry, we kind of live on the outskirts. There's usually, when they say healthcare fraud, they're usually going after, Vicodin dealers in Florida and things like that. But I'm not taking any chances. It's just way too easy nowadays. I remember one auditor, or I'm sorry, he's not an auditor, but he was a compliance officer for a carrier. I mean, he said very bluntly, it's like shooting fish in a barrel. Like, you will catch an office. If you audit basically 10 offices, you will find 10 instances of prosecutable fraud or abuse. And I just thought, geez, that's pretty sad, but I don't think he's lying. It's just the state of affairs in not just dentistry, but healthcare in general. So let's move off of Medicaid. The legislative side, lots and lots of laws that are being passed. And this was not only spoken of in the general session, but in one of the breakout sessions, there was an acknowledgement that the network leasing issue has really kind of gotten out of control. Carriers were saying, yes, we hear you, it's difficult. But the really big thing that I want you to think about here is it really has gone out of control. As you know, I mean, we've had tons of carrier shared lease agreements and terminations, just a slew of them in the last month and a half or so. The carriers are also having trouble, keeping up. And will they say that publicly? No, but, it's comments, that I'll have little conversations where it's like, yeah, we struggle to keep these directories updated. Legislation is what worries the carriers a lot, because if they can't get it together, then legislation is what's going to get it together for them. And so we have reached a point, though, that many states have said, you know what, we've just got to go to the legislature. And you're finding that with network transparency laws. Many states have passed laws that say, look, if you're going to be pushed into a different network arrangement, there has to be an actual signature acknowledgement. Some laws are being pushed that actually require an opt-in, not an opt-out. That's traditionally, like, if you don't say anything, you're opted in. Like, that's called the silent opt-in. And what they ask many times is that you have to physically opt out. Well, the laws would make it so that you have to opt in. You providers would have to opt in rather than the other way around. And so that's more proactive and actually a little bit more defensive if you think about it, because the carrier can't just pull a provider into a network, and the provider, who knows how they're getting notified. It was a really interesting lunch conversation I had with someone from a carrier, and they said, how do you think these people are getting the notifications? And I will say, I can see both sides. There's no blaming anybody here. There's no blaming of the carriers. There's no blaming of the providers. It's just, this is what is happening. The carriers are sending emails. They are sending letters. And if they are under ERISA federal law, this is mandated. There's like, they can't just say, hey, we sent it, and then just kind of hope you don't check. They do need to notify you. And so they say, we send all this stuff to them. What else can we do? And I said, it's not that, you guys are doing everything, but I mean, there can always be more outreach. My thing is, I think we need to have more time. It can't be just a 30-day notification. The other side is, how often are you having people update their provider directories? Because I know people who have moved from office to office, and I can bet that they're still listed as the contact on their old office. And so, I mean, think about it this way. If I had put my personal email at my office, I probably would still be getting notifications for different things. That's what I mean. Like, the information is not necessarily as accurate as possible for the carriers to get all this information out to them. Is that fixable? Well, yes. But if you think about it, how many times do you get notification from a carrier that's like, go update this, go update that? And if you don't have somebody dedicated and nerdy like we are, it's going to get pushed to the side. So do you, as soon as you get a notification, go in and update everything? I mean, maybe, maybe not. And that is the big struggle with the carriers. And so for them to have this legislated, meaning they must keep their provider directories updated, they must obtain opt-ins, to them that adds more administrative tasks. And it was brought up that, offices don't want to talk to us anyways, unless it's about a claim. So when we do call them or send them information, like, that, we're not going to get through. So do you really want, Delta or principal calling you to remind you about a directory? You probably get pretty annoyed. I mean, I know, look at how we are with sales reps. If we don't like the sales reps, we're not putting anybody through. So I see it from both sides, but I also know that there's this fix that is not ideal, is a fix to a problem that just got out of control. So, and this is what I have said to carriers, is like, you really lost control of it. I mean, it really is like a freight train that just got away from you, this whole network arrangements and stuff. So another conversation I had too was with someone who had shared, that they had seen kind of the behind the scenes on the leasing arrangements, and they are very lucrative. So, are the carriers going to keep pursuing this? Probably, because they're very lucrative. So, and they're stockholders, there's all of that. So I don't see those arrangements ending anytime soon. What I do see is perhaps them slowing down and maybe giving us that 60-day window or 30-day window. And they might do this. They might opt to do this before it gets forced on them in a state. So if you think about it this way, let's just take Principal, for example. Principal does business in very many states. They actually have to track state law in all of these states to make sure they're compliant. So if one state, they could probably manage it. It's kind of a pain, especially if it's like Rhode Island, they could manage it. But a state like California, that's a whole department that's going to now need to be hired and brought in. There's just a lot. And you can see why with health insurance and healthcare, why the costs just go up. The administrative side of care has just really taken over so much of the cost. It's really, really wild. And that's from a really high level view. That's just me going, holy cow, the numbers that are involved. And we're just dental, you all. I mean, this is nothing compared to what goes on in just like one metropolitan area in healthcare, like that, like Washington, D.C.'s healthcare, Northern Virginia's healthcare, where I am. That's probably the dental industry compared to the whole healthcare industry. And it's wild to think on that scale. Okay, so another conversation that people were really kind of dominated was this whole multi-factor authentication issue. And so most of the carriers are rolling out more secure ways, which I have no problem with. It's just that, and I do think they've given us plenty of time. I really do. They've been kind of banging the drum about this for a little bit, but offices still aren't ready. And honestly, the system isn't great. So, with Dental Revenue Network, membership is full of billing companies, billing company owners, billers, and anybody who loves revenue cycle, really. And so on behalf of DRN and our industry, the providers industry, one of the work groups I'm a member of is the operations work group. And they were asking is there anything we need to consider for 26? And I got up and talked about multi-factor authentication. Before I launch into that, I just wanted to add that another work group that had met earlier that morning is the DSO work group. And the DSOs brought this up and were pretty adamant about it. So it was actually pretty interesting. One of the carriers came up and said, okay, so if the DSOs want it and you with the smaller providers want it, then I guess we need to talk about this. And I thought, yes, we do. So why it's important to small providers, billing company, my constituents, and the DSOs is that when you have multi-factor authentication, it's not just for one person that I'm concerned with. You have multiple people in an office that are accessing portals. Many of the portals are, if it's set up by tax ID number, there may not be multiple emails that you're able to log into. So, you've got me, Sally, Jean, all of that at an office. We are logging in under one email address and password. Well, if I'm working from home, I need to put in an authenticator now. Well, I don't have the authenticator app. It's on the computer. Well, Jean's working there. Maybe I have the authenticator app and nobody else does, but Jean wants to go check something. So that's a problem. So what I would like to see, and also I know what the DSOs would like to see, is some sort of hierarchy, some sort of super user, but then hierarchical access for different users. And what that means is like there's Teresa at Odyssey Management. I'm the owner. That would be the super user. Then I would delegate, Jean, I would delegate Colleen, I would delegate Estella. They would be the users under that. Well, if Estella decided to leave the practice, shout out to Estella with remote sourcing. If Estella decided to leave my office, then I could just cut off, as a super user, I could cut off her access and I would be able to do that very quickly. As it stands right now, if Estella were to leave my office, then I would have to find out if I have her password, that's great. Then I would be able to shut it down. But what if I don't have her password? What if it's not saved anywhere? Then that's an open liability according to HIPAA, because she could go home. She could go to another office and she could log into her portal. And now that she's working in another office, she might still have access to other data. So you can see how it's very, very problematic. Well, when you're a billing company, third-party outsourcing company, it's even more crucial. You have more people, you have multiple offices. And so one of the suggestions I had was, is there a way for, and I believe the DSOs are on the same track, is there a way for third-party companies to register as a user, as an entity on these sites, and then their billers would be able to have access? And so that's not something that many of them have the ability to do at all. That's going to entail some software architecture reprogramming. One of the carriers that just came on to Dental Revenue Network for a deep dive, they admitted that they don't have multiple email fields. So when you log in with that tax ID number, you have one email address that's attached to it. That's, again, problematic. So we may see some, right now you should get ready for multi-factor, but we may see some changes in login and access and all of that. I hope so, because the way I firmly believe the way the industry is going is that I don't think there's going to be a lot of revenue cycle being done, especially at the DSO level, in an actual office. And I am talking to a ton of smaller offices, 1 or 2 location offices, where the RCM is not in the office at all. It's either outsourced or it's centralized. It's not in the office at all. So this sort of super user concept may really help. There's a lot of ways. On the most recent Dental Revenue Network all hands meeting, we were discussing what are the different options. Some people threw out LastPass, some people threw out Unify, some people threw out using the Microsoft Exchange because it's a secure internal system if they were using it. And Microsoft Edge as well, if it was secure. Unify, I got to speak to Tanner Applegate over at Unify, and he's going to come onto the network and do a demo, but you all could also as well. It's Unify with UNIFY. I'll put a link in the show notes. But it's a password manager, and you can pretty much have everything in there. Your Darby, your Synergy Dental, your, Odyssey Management, your Dental Revenue Network passwords, but also your portal password. I wouldn't combine it and use it for personal, but it would be something for the office to use. Actually, a really brilliant concept. And so, but I have not used it, so I can say it looks good. He's done a lot of work on it. When I first saw it, I was like, I don't know if you're ready yet. Looks good now, but again, not a user, just telling you that that's an option that's out there. And it can handle the multi-factor authentication, the authenticator apps, and all of that. So that's going to be really important if you're in the market for this. So another discussion that we had was credentialing. And just like when we go to Hinman or Chicago Midwinter or Star of the North, that type of thing, all we see are vendors, right? We see all these vendors trying to get us to purchase. They have quotas and all that kind of stuff. When you go to an NADP meeting, and I remember the first one I went to, it wasn't big. It's nothing like, a show Florida dental meeting. It's much smaller, much more intimate. You actually have a lot better conversations. But what you see a lot there are data companies. So companies that do nothing but handle data, analyze data, collect data, all that kind of thing. You may be familiar with a company called P&R Partners. They were collecting a lot of the dental data way back when I first started really getting into this side of the insurance world. And then they were acquired by Fluent. So if you ever had a peer-to-peer with a dentist, there's a good chance it could have been a P&R partner dentist that was hired by P&R to do the analysis. So P&R will do what we call claims adjudication. So a lot of times the claims will actually they'll go through the clearinghouse, then they'll get sent to, say, a Fluent, a company like Fluent, and then they would evaluate it and then kick it to their consultants, and then it would get, and this is processed very quickly. It's not like multi-days. And then it would get sent to the carrier for approval or for processing of the denial, or what we call adverse decisions. So we always think the clearinghouse is the middleman, but there's another one in there too. So I had a meeting with them because they also have a product now that has to do with credentialing. And as our offices get bigger, more providers, you are seeing a lot more need to centralize credentialing and actually be able to give them everything that they need. And so whether it's CAQH or Fluent solution, and many of the negotiating companies, by the way, build their own solution to gather all of this data. For example, let's just say MetLife has a certain amount of information they need on a credentialing application. Over here, it could be Mutual of Omaha that does not want all that information. They have different information, right? So how do you keep that straight? Well, it's going to be a software that's going to have everything. Now, CAQH right now is what the ADA has a partnership with, so many people use it. But I've been told that there are pieces of information that CAQH does not store that other programs could. Now, I'm not an expert on that, but if you are in the market, and this is really not for the smaller office, but if you're in a DSO or getting to that size, it might be something for you to take a look at. I know carriers, the real benefit of that is having the carriers go there to get all of the information. An example you may be familiar with is SkyGen. SkyGen takes a lot of information and the carriers go there and they can see all of the providers in the network. Doctors can keep their directories open. So what I fear is that we're going to get to a point where there's going to be tons of different directories, but you as an office are going to go, well, I'm in CAQH. Why do I need to do all this other stuff? And if carriers start to do exclusive deals with these directories, then that could be a problem. I just don't see that happening, but it is something that kind of, I always do the pros and cons whenever I hear a business concept, and that's one of them. So when you are looking at data, whenever you see data, a lot of people think, oh, let's look at some graphs and all of that thing. So when I hear claims data, I immediately think fraud, waste, and abuse. The algorithms are out there that they can catch outliers. They've been doing this for a while, but now they are really good. And they are able to take a look at hundreds, thousands of claims and see patterns across geographical areas, tied to a provider number, tied to tax ID number. I mean, it's just scary how good the analytics are. So Codivity is another company that they really have a good product out there. I'm actually looking forward to my next meeting with them because they have all sorts of data on the clients who are finding fraud and abuse in the claims, fraudulent intention, right? And abuse, like abuse of codes, unbundling, things like that. What they are doing is identifying these outlier providers and sort of giving a heads up to the carriers. I'm not excited about that, but that's business. It is what it is. What I'm excited about is when they can find these patterns and find these billing patterns. And I know, and they actually were very open to this, so I'm excited. I said, let me have this information. What are you looking for? What's coming up on your big list? And let me take this back to audiences and to the billing companies and let them know, hey, if this is the reason why they're asking for more information, this is the reason why your provider is submitting additional documentation because they are an outlier. Perhaps it is a billing pattern that a new doctor just doesn't realize. Maybe a manager told them to bill a certain way and unknowingly that's landing them in hot water. So I just think, as always, there's a ton of education when it comes to coding best practices, and letting people know what are the big fraud triggers is nothing but helpful to both sides. Neither side wants to do fraudulent stuff except for the really bad apples out there on both sides. I mean, do I think carriers are angelic? No, I've definitely come across carriers that no matter what they say, I can tell by my own stats, my own reports, that things are getting denied without anybody even being able to look at them. So are they all angelic? No, but many dental offices, you can just go on Facebook and see the people basically bragging about how they get away with things and billing and so forth. So I'm all about making sure that everybody plays by the rules, because not playing by the rules is expensive and it can cost your license. And if you've listened to any of my management classes, the most important thing to me in an office and my driving force is protecting the doctor's license so that we can continue to provide care. For me, that's my job as a manager, right? So let's go into then the 4. I was very interested. I watched a little demo from Fluent, and again, they have this product. I think it's Smart Claims Focus is the name of it, but they did an analysis and they were identifying the top 4 fraudulent codes or potentially fraudulent codes that were really coming up on the algorithm. So again, been teaching insurance a long time, always surgical extractions and simple extractions, scaling and replays and crowns and pulp caps were always dominating the top flags, over use of sealants as well. So it was really interesting to me that the top 4 that they listed were a little bit different. So the first one was 2, 3, and 4 surface composite fillings. Okay. Or actually just fillings. I'm assuming they mean composite fillings because of course it's going to get downgraded, but it was interesting that they called out fillings and then in parentheses, amalgam and composite. So I guess to them, it's all the same. The next one down was scaling and root planing. And then we had one surface composites. And I thought that was very interesting because they actually parsed out one surface composites separate from the 2, 3, and 4 composites. And I'm just going to look at my notes here because I thought that was really interesting. So, I apologize. I skipped one. So 2, 3, 4 surface fillings were number one. Number two, of course, scaling and root planing. It's not a fraud trigger unless scaling and root planing is at the party. Crowns are always going to be there because crowns are high dollar amounts. So if you think about that, crowns and frequency, another high dollar amount, endo, another high dollar amount, implants, but they don't have the frequency that crowns do. So it makes sense that that's going to land there. Then you have the one surface fillings. So I have definitely seen a trend, as have you, that we are being asked for diagnosis for fillings, but also being asked for radiographs and an additional documentation for fillings. Well, why the heck are we sending in an x-ray for fillings? Well, this is why. So does this mean that more people are doing fillings? Well, I mean, that kind of makes sense. People have bad habits. We have a ton of sugar in there in our foods. People just have bad oral health habits, right? You have an aging population. Some of these people who never had a cavity, now they're getting their first cavity. You have a lot of children. So I'm not surprised by seeing fillings on there, but it was very interesting to me to see them kind of parsed out like that. So what does that mean for you? Well, when you are dealing with one of those, anything in those 4 categories, when you get a request for information, first couple times, I don't know if I would really kind of freak out, but if you're continuing to get these requests for information across different carriers, it could mean that you've been flagged somehow. Within one carrier, I wouldn't worry too much because perhaps that carrier, maybe they have different benefit guidelines and all that. But across different carriers, that's when I start to really worry. I just think it's a good time and a good reminder. Actually, it's always a good reminder to go back and take a look at your documentation and make sure that it is explanatory, that your fillings are documented, the reason for, and what happened during the procedure. So again, clinical note, all goes back to documentation. What you've seen in my classes, I'm sure, documentation drives revenue. Now more than ever, that is very true. Another point on this with the fraud triggers is that I did not see surgical extraction on that in the top 6 or 7. And surgical extraction has always been one of the top ones. So it was really interesting to me to see that drop so much. Is that because maybe people are they know the difference between simple and surgical extraction? That would be great. But it was just really interesting to me. So maybe we're not extracting as many teeth as we did before. I don't know. I'm very curious about that. And somewhere out there, somebody has data on that because I have learned that they have data on everything. So very interesting there, the fraud triggers. Another trend that we were talking about too was Medicare Advantage and the restricting of Medicare Advantage. And if, again, you all have probably heard me in a class before, but what I will tell you is that I feel like Nostradamus because my predictions on Medicare Advantage are coming true. The first year after COVID, when we were talking about Medicare Advantage, I said these plans are too good to be around for too long. The utilization is going to go through the roof. The plans wrote these without really thinking about just how much free time seniors have on their hands to go get dental work done. And it's also a perk that they didn't have before. So it's a pent up demand, meaning when you first offer it, there's going to be a huge demand. Then, of course, think of it like a new Walmart opening or a new Target opening. Everybody wants to go see it, crowding in there. And then after a week or so, it's all right. You can go in there. Well, this is a longer run, right? So now you've got seniors across the country who used to have dental care, perhaps when they were full time, didn't have it for a long time, were on their own. Now they have dental care again. And by the way, $3,000, $4,000 maximums, yearly benefits. Of course, they're going to utilize it. So I did say, I think 22, that this was not going to last. This is the golden age of dental Medicare Advantage. Well, I did pat myself on the back a little bit because what was discussed in the sessions is that we are going to see a constriction of Medicare Advantage plans. They will have different plan designs, more restrictive. You may see that preventive is completely covered, but maybe restorative, meaning like your fillings are covered, but then the rest of it, the big ones, are not. You might see lifetime frequencies on procedures. When you are looking to bring down utilization and increase patient out of pocket, there are going to be some funky plan designs. So I would more than ever next year for sure, and 27 for sure, look at these Medicare Advantage clauses in the certificate of coverage booklets, because I do think you're going to see a lot more variation in plan design. Now, it sounds to me, they did warn that you would most likely start to see closed panels or restricted networks. And that's kind of an EPO model. So remember, PPO, you can go to a dentist that is out of network, but you're going to pay a lot more. EPO, exclusive panel, is really exclusive provider organization or network. If they go to any dentist that's not in the network, that would be it's all out of pocket. There's no benefits at all. I do think you will see, maybe next year, but for sure 27, you're going to see a lot more plans where in order to get benefits, they have to go to our participating dentist. Case in point, my parents have really good dental plan through Medicare Advantage. My doctor is not in network, and they got their full yearly benefits, both of them, because they needed work done. So they definitely needed it, and they were grateful and happy, and they had all the time in the world to go in, and the premiums or the yearly benefits were used up pretty early in the year. Remember, they have a lot of time. So another interesting conversation that came up, I had read about this, but I really didn't pay any attention to it because, Teresa brain didn't engage. But there is now a mandate, Medicare Advantage plans, and not just dental, but medical too. I think it's passed. I think it's actually going into effect. They will need to notify subscribers by middle of the year, just right after that they have this much amount left of their benefits. So basically the carriers are now being required to send that use it or lose it letter around mid-year time. So one of the representatives on the panel discussion said, okay, well, what does that mean for the provider's office if we're sending letters to say, hey, go get, are you going to be able to handle the flow of patients? And I thought, okay, that's really a very carrier-centric view, because across the country, doctors are going, yes, we can handle this, and I especially know some of you are slowing down now. September is a real thing, but would you be able to handle, say, if every senior in your practice got a letter like this? So I see what he's saying, but I also thought that was kind of a weird argument for him to bring up, because we will handle it, right? Seniors will handle it. Believe me, if anybody's going to take the first open appointment, it's going to be a senior who really is just kind of hanging out. So I don't have any issues with that. I thought that was kind of a weird counterpoint. I do think it's great because a lot of people don't know how to use their benefits. And so anything that helps the patients get care, I think that's fine. But I had totally forgotten about that. And so good. I mean, if the carriers want to do the reminding, that's good with me. Happy about that. So there was a lot, there's definitely a lot more. A lot of the side conversations that I had really indicative of how much struggling the offices are under to manage the networks in particular. But one thing that was very crystal clear is that the staffing is really impacting the insurance industry, which is again why you see a proliferation of third-party billers, because a lot of our insurance people are leaving and starting their own companies. And I've seen the growth in Dental Revenue Network. We are definitely growing in numbers, and many of them are company owners. So I just want to do a quick, if you are a dentist and you do lose a person to burnout, or they decide, hey, insurance is not for me, you end up losing somebody and you're considering outsourcing. I do want to give you a couple caveats, because I have heard some horror stories. Definitely since starting this membership, I have heard some horror stories. And I have also seen really good examples of really stellar business being done by some of these companies. So I'd like to warn you about is, number one, make sure that the person that you are considering hiring, that they are actually a legitimate business. And every state, you can go and check with the secretary. There is a business listing. If you're incorporated in a state, you will be there as well. As for a business license, I don't think that's weird at all. When a dental company or when a third-party billing company wants to join my membership, I look to see if they are an existing business. We chat a little bit about business insurance. Not everybody has that in place, but they understand the importance once they join. I'm actually looking at making that a requirement for the owner's level. Cybersecurity insurance, you need to be comfortable that the person you hire, the company that you hire, has IT in place that can protect your data. It's not just somebody who carries a laptop around and logs in from whatever. You need to have really secure networks and access in order for them to handle your information. Of course, getting a referral from a friend is great, but in my experience, doctors refer people they like working with, but that doesn't always mean that that person is HIPAA compliant, has a business license, and has errors and omissions insurance. This hurts to say, but somebody who has been in practice, opened their business for maybe 6 months or less, I don't know if they would necessarily have all of the infrastructure in place to handle a really heavy client. So a solo doctor, yeah, that's good. Training wheels and all that. I don't want to be anyone's training wheels, but sometimes this happens. It's something that I don't think a lot of billers understand when they start their own companies. You need software or some way to manage all of the EOBs, access, the client management. If you hire W-9s, contractors, or W-2s and contractors, you need to have payroll, you need to have HR documents. You know, doctors, just like when you opened up your business, you had to have posters, you had to have this, you had to have that. This is the same thing. They're a small business. And so as much as I admire the drive of someone who wants to start their own company and set up in the living room and get started before they really make it official, that's not good enough for my patient's data. I think you should see it that way as well. So again, not discouraging any new biller stepping out. There's policies and procedures. There's good ways to do business, and then there's quick ways to do business, not unlike somebody who wants to skip dental school and just start taking out teeth. I mean, I wish we could do that. I wish you could fast track and be very successful in a third-party billing company business, but you got to do it the right way, and it could come back to bite you. So there's, fines, all that kind of thing. I would also urge you to use a US-based company with US-based employees. I am not comfortable with data going overseas. I have friends that we kind of go back and forth and argue about this, that's safe and Amazon servers, all that kind of stuff in the US. I don't care when it comes to my patient's data. If it's somebody in a country that, they're gone. I have no prosecutorial anything. I can't go after them. In the US, I have a little bit of ability to recover or whatever, but I would also check your own business insurance, your own cybersecurity insurance, to see if there's actually something in there that states you can't work. Your data has to stay in the States. I do think that's the direction it's going in anyways. And so again, this is actually why for DRN member companies, I don't let in anybody who's based or employees that are overseas. I firmly believe that needs to stay in the States. So that's what I would look at. Make sure they're set up as a business, they're legit, business insurance, cybersecurity, US based, and that they keep up on insurance. Still a frighteningly large number of people who say they're insurance experts and haven't taken an insurance class in years. Listen, I've been teaching a long time, but there is no way that I would pass up an insurance class if I had the time to sit and do it. That's why I go to a National Association of Dental Plans. That's why some of the colleagues from DRN, they go, we learn about it. I'm constantly devouring information about coding, plans, reading plan documents. Your revenue, your profitability, you want to put it in someone's hands that's just as dedicated to your business as you are. Obviously not as much as you are, because no one is as dedicated as you are, but you get what I mean. They take it as seriously as you would want them to, not somebody that's kind of doing this as a side hustle. Your revenue, your house payment, your kids' college is just way too important to me than to just trust it to someone's side hustle. And I know that sounds harsh, and I apologize to all the side hustlers out there, but I hope you understand where I'm coming from. So that's my wrap up with National Association of Dental Plans. Every year I go, every year I come back with lots more information, kind of feeds me and feeds my classes for the next year. It's probably one of the best memberships that I have, because not only have I made a lot of friends on the carrier side, but I've also, through those friendships, been able to understand how they do business and why they do business, which helps me come back and translate a lot of this stuff for you. And although the carriers and, our goal is always to take care of the patients, they have a different road to get to that goal. We have a different road, right, to get to that goal. And I think it's important to understand that there's just two roads. We need to know what's going on over there. They know what's going on over there. We need to continue to talk, because both sides think their road is correct. And really the magic happens when we can collaborate and talk to each other openly instead of, raising the fire and having rhetoric, like all insurance sucks and all that kind of stuff. Fun to say, not really easy to implement because nobody wants to be emotional when you're putting in an EOB. I mean, let's be honest here.
Are you a dental biller feeling overwhelmed and isolated? I get it. The world of revenue cycle management is complex and ever-changing. That's why I created Dental Revenue Network. Our membership community was created to help you become a better revenue cycle manager and small business operator. Say goodbye to feeling alone and hello to a supportive community of dental billing professionals. Here's what you'll get: monthly billing-focused meetings with peers and experts, business building sessions to elevate your career, resource libraries tailored for billers and billing company owners, introductions to cutting-edge RCM technologies and companies, and a vibrant community for networking and support. Ready to transform your dental billing experience? Visit dentalrevenuenetwork.com today. Don't wait. Join us now and navigate the business of RCM with confidence.
So I hope that that's been helpful. If you have any questions, hit me up. If you're not on my newsletter list, there's a link to sign up in the show notes. And if you're watching this on YouTube, I want to thank you for taking a listen to the channel, and I hope that you subscribe for more updates. Check out Dental Revenue Network, and I will see you for the next episode. As always, I want to thank you so much for sharing your time with me.
If you learned something new today, subscribing is the best way to support the channel and keep learning with us.
We're all super busy, so thank you for making time for me today. The show notes will have any links that we referenced in the episode. You can also find links for my book, events, and my online insurance course, Dental Insurance Design and Management. I speak often around the country on management and insurance issues. Come hang out with me in one of my classes. I promise you'll laugh and learn.